Nutrition in liver care for geriatric care. Introduction. Aging is a condition in which a person gradually loses the ability to maintain homeostasis due to structural alteration or dysfunction. Like all organs, the liver also experiences various changes with aging, specifically a decrease in liver volume and blood flow. Studies using ultrasound have shown that the liver volume decreases by 20% to 40% as age increases. It has also shown that people aged 65 or above show approximately a 35% decrease in blood volume of the liver. Additionally, aging causes a declining number and dysfunction of mitochondria in the liver. This change and decrease in cytochrome P450 activity can affect drug metabolism, increasing susceptibility to drug-induced liver injury. Nutrition in liver health. Along with decreased liver function, aging is associated with decreased nutritional intake. It is a known fact that as older adults are less active, their rate of metabolism and energy requirement is reduced, which means they consume a less amount of food. However, malnutrition can further increase the risk of liver disease. It has been seen that malnutrition, along with obesity, increases the risk of non-alcoholic fatty liver disease, NAFLD, in 25 to 51% of the elderly population. Similarly, malnutrition is a poor prognostic factor in 20% of those with compensated cirrhosis and 50% with decompensated cirrhosis. Therefore, it is important to maintain a nutrient-dense diet for older adults, which should include caloric needs to maintain proper nutrition should be 1.2 to 1.5 times their basal energy expenditure. Protein intake should be between 0.8 and 1 gram per kilogram per day. Fat should not account for more than 20% to 35% of total calories. A regular diet contains between 2 and 4 grams per day of sodium, 600 IUs of vitamin D per day, 2.4 micrograms of vitamin B12 each day, 3.7 liter per day for males and 2.7 liter per day for females. Tips for maintaining liver health. Some additional tips to maintain the liver in optimal condition and reduce the risk of liver disease in the elderly population are: avoid high-calorie meals. People over 40 are advised to avoid refined carbohydrates, high-calorie meals and sugars, as consuming these additional calories can lead to obesity. Obesity can contribute to NAFLD, prevalent in older adults. Raw or undercooked fish should be avoided. Limit saturated and trans fats. High intake of unhealthy fats can contribute to liver inflammation and damage. Encourage the consumption of healthy fats like those found in avocados, nuts, and olive oil. Boost fiber intake. Fiber aids digestion and can help reduce the absorption of toxins in the intestine. Increase foods high in soluble fiber, such as oats, beans, and fruits like apples and pears. Include antioxidant-rich foods. Antioxidants help protect the liver from oxidative stress. Moderate alcohol consumption. For individuals with liver concerns, it is best to limit or avoid alcohol consumption entirely. Alcohol can exacerbate liver problems, leading to severe complications like alcoholic liver disease, ALD. Avoid unprescribed herbal supplements. Herbal supplements are typically recommended, used, and expected to improve a person's health. To avoid any interaction with concurrent medications, older adults must use herbal supplements under the guidance of health practitioners who have knowledge of the prescribed supplements.